Hi, it's Emily from Grounded Practice. Coming up is a video about my emergency appendectomy and just what a crazy experience it was, especially in this time of COVID. But before I show you that video, I want to make sure to just put this big disclaimer in front that I am not a doctor, that none of this is medical advice, and that you should always talk to your provider, naturopath, practitioner before implementing anything into your healthcare routine because they can help you be best. This is just my story about my experience during this time. So thanks for watching. Bye. Hi, it's Emily from Grounded Practice. I hope you're having a great day. I am sitting in my bed recovering 4 days post emergency appendectomy. And last week we had the intention of sharing all these new videos that my social media managers, aka my kids who are 9 and 12, had an idea for. And I just was feeling off the whole week. I couldn't tell. I just had the worst stomach ache. We had just come back from being gone for a while. So I thought maybe it was just getting into our new routine, getting used to the masks, driving the kids to practice, kind of adjusting to all of that. But I told them I just wasn't feeling it. And then by Wednesday, I really wasn't feeling it. I had this terrible stomach ache across the top of my stomach. And by 6 o'clock, I told my husband, I have to go to bed. I don't feel good. So I went to bed, had a great night's sleep, woke up, I'm like, I'm feeling better. And then I got up and it just hurt so much again. And both my kids were like, maybe it's your appendix. Remember that guy on Survivor who had laid down? And as I'm laying there, I'm like, yeah, and it is kind of going to the side. And my husband says I'm breathing like I'm in labor. And in the back of my head, I hear my friend talking about how her dad just got out of the hospital after a month for one that burst. So my husband's like, we really have to take you to the doctor. So I agreed to go, but I didn't want him to drive me because I just thought it's probably gas and he's gonna have to wait in the car and I just rather drive myself. So I drove myself to the doctor and pretty immediately found out it was my appendix and I was gonna need surgery right away. So they didn't want to let me leave. They wanted my husband to drive me. Long story short, I convinced them to let me drive me home. My husband and kids took me to the hospital, which was a very surreal experience in this time of COVID. I mean, if you're going to draw an emergency surgery during this time, an appendectomy is not a bad one to have. It's a quick, pretty common procedure, but I still wanted my husband to be able to be in there with me, but he wasn't allowed to. So I just kind of bye, and they waved goodbye to me too. He said it was like dropping me off for a sleepover, but with swords, and he didn't like the feeling of it either. So I went in and I was feeling a little anxious because even though we're never in control, I do a good job building this illusion of control around myself. And as I was waiting to have surgery, I just started feeling nervous. And I was telling the nurse, I'm not as anxious about this surgery. Like, I know you do them all the time. I just don't like the idea of just being asleep the whole time and not knowing what's going on. And she's like, oh, it's totally normal. She said, we can talk to the anesthesiologist if you want, and we can see, if she can give you something, or we have tons of success with aromatherapy. So of course I'm like, yes, I'm all in. In my bag, my husband had packed my favorite lavender. So I said, well, what do you use for anxiety? And she said, well, lavender. And I said, oh, I actually have my favorite bottle of lavender. She's like, great. So she took my doTERRA lavender and put 2 drops on a cotton ball. And at the hospital now, you have to wear a mask the whole time. The only time I was allowed to not have my mask on is if I was in my hospital room by myself with the door shut. So I have my mask on, and she takes this lavender cotton ball and she sticks it right on my mask and just tapes it with surgical tape and told me to breathe in and breathe out. And just this beautiful lavender filled my mask, and I just breathed in and out. And she walked through some things I could picture, and she put this nice natural scene on the TV, and it just really relaxed me. Because it was an emergency surgery, I could not get a COVID test because they wanted me to get in there right away. So they had this procedure where the anesthesiologist and her assistant in all their COVID PPE brought me into the surgery room, and then they put me to sleep, put me in a breathing tube, and then we sat in there for 20 minutes so all the air clears out. And then the surgical team comes in with all their regular PPE on. And then after the surgery, everyone leaves except the anesthesiologist and her assistants, and they take out the tube, put my mask back on, and then sit there again for 20 minutes while all the air clears out of the room. So by the time I woke up, it was probably like 2 hours, even though the procedure was really quickly. To me, it felt like nothing, obviously. I was like having a dream and woke up and couldn't believe I was in the hospital. So I woke up and I just had this immediate sensation of just not being able to breathe, like being really hot. I have this mask on. They were sweet and put all these blankets on me, but I'm just like a warm person. So I was just like, oh, I was so hot. I just wanted to take off my mask, and I'd had the breathing tube in for that whole time. So my throat was dry. I just wanted water, but I couldn't have my mask off. And I kind of told her I'm starting to feel like anxious. Can I have that lavender again? And I'm feeling a little nauseous too. So she's like, yep, we're almost to like the recovery area. So I'll get you taken care of right away. We didn't have my lavender this time, but we used theirs. And then she also said they have great success with ginger. So this time I had 2 cotton balls taped to my mask, one with lavender, one with ginger, and I just breathed, and it really did just support me so much. So we make it through recovery. I get to my room. I'm still feeling pretty hot and nauseous. The nurse said, you know what, once I leave, take off your mask, tape. I'll give you these she gave me new tape with cotton balls of ginger and lavender. She said, tape them to your gown and just slowly like eat these ice chips and drink water and you'll feel great. And I did. And I was just so thankful for how this hospital utilized like holistic plant supports that I use at home all the time. The nurse was telling me that there's been a bunch of NIH studies where they show lavender reduces anxiety, and it can be as or close to successful as the medications, and they just really try to go the natural route because of a lot of the medications they give, even though they're super helpful, they slow down the digestive system. So with your appendix, like I wanted to get home as quick as I could, and you can't go home till you have movement. And she said, you know, some of those drugs they give you, even though they really help, they kind of slow down that digestive process. So that means you have to stay in longer. And I was pretty hungry because I hadn't eaten for a couple days, had been feeling so bad. So they gave me some veggie broth, some ice chips, some like Shasta something or other, and let me be. And I drank all the stuff. And then I called her because I had to go to the bathroom. She's like, that's great news. You're going to be able to go home in the morning for sure. And then either the pharmacist or the doc, he was a doctor, but I don't know if he was like a pharmacy doctor. He was just talking to me about all my supplements and kind of what I wanted my plan to be for the night for pain management. I told him I'd brought these turmeric capsules from home that I love, and that I kind of didn't want to do anything heavier than Tylenol if I didn't have to. And he's like, okay, well, let's just try Tylenol and your turmeric. And again, he mentioned there's been some studies that show that helps decrease swelling and pain management and all of that. So I did that, and I ended up not needing any pain medicine the whole night other than that. And in the morning, the doctor came in and I was good to go. So I was there about 12 hours. And my husband came and picked me up from the sleepover, and we walked out of the hospital and we're on our way home. So it was just a really crazy yet amazing experience, and I feel so much better. I mean, I'm 4 days out. I've been relaxing here in this bed. My kids have been pampering me, and my husband as well, which has been wonderful. But I've got some big takeaways that I'm just going to keep with me. And one is, like, I already knew this, but plant medicine is magic and it works. And there's so many ways we can implement it to support ourselves. Western medicine is great too. I mean, I now am appendix free. It didn't burst. I could have had a lot of issues had that happen. So I'm super thankful for that. And also, sorry, I'm just playing with my hair while we're talking. So yeah, and the other thing is I love this like cotton ball as an avenue for aromatherapy, because there's times where we're on a car ride or a plane ride and my kids kind of get motion sick or they're not feeling well, and they don't necessarily want me like putting the oils all over them, even though that's what I want to do, because they don't really want to be like smelling like those oils when they get to their destination. So I love the idea of just having some cotton balls and some oils if we're going on a longer car trip or a plane ride, and some painter's tape, and just putting a drop on the cotton ball and just taping it right to their clothes, and they can breathe in and just feel so much better. So I'm definitely going to use that going forward, as well as even if they're sick at home and I don't want to, you know, diffuse ginger and lavender and peppermint, even though I like how that smells through the whole house, I can just tape it on them. Also, already knew this as well, but healthcare workers are heroes. Every single nurse and doctor I worked with was the most empathetic, compassionate, awesome person. You know, they're in all this gear. I was hot with just a mask on, and they don't even once seem burdened. They're just straight up presence and totally there for you. So thank you, healthcare workers. You're amazing. And the third thing is, like, turmeric is awesome. Now, as I said in this disclaimer before this video, I'm not a doctor. I don't want any of this to be medical advice. Like, talk to your doctors. Turmeric is super powerful, and there's tons of studies out there about how it supports. I also read a lot after I got home about how sometimes doctors don't want you to take it before surgery because it can reduce clotting. So always, 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 always talk about your supplements before you have a surgery, before you do anything with your doctor or your naturopath or your provider, because they can help you be the safest. This is just my story that I wanted to share. So I hope you're having a great day. I'm excited for what we're going to be bringing to you. We're going to start a new a new series called Grounded Practice Daily, which are going to be short 1 to 3 minute videos that highlight little practices that work. And you can find more in an intro to that in this page next. And yeah, I just feel so much better. I think my appendix was probably not good for a while, and I'm just so happy to be healing. So thanks for being here.